Let's discuss the Chong penetrating vessel, blood stasis in gynecology. Blood stasis in gynecology, the penetrating vessel, is the sea of blood, and its pathology is at the root of many gynecological problems. The three blood pathologies that affect the penetrating vessel are blood deficiency, blood heat, and blood stasis. When there is blood deficiency, the woman may suffer from amenorrhea or scanty periods. When there's blood heat, the periods may be very heavy. When there is blood stasis, the periods will be painful and the menstrual blood will be dark with clots. The penetrating vessel is used particularly to invigorate the blood when there is blood stasis in the uterus. Indeed, this is the pathology of the penetrating vessel. Therefore, we can use this vessel in any case of blood stasis in the uterus. The points to use are opening and couple points, spleen 4 and PC6, that's kidney 14, and spleen 10. The penetrating vessel is the vessel to use for blood stasis in gynecological disease. So we use spleen 4 on the right, pericardium 6 on the left, kidney 14, and spleen 10. The penetrating vessel and the membranes. The nature and function of the membranes have already been discussed above under the directing vessel. The penetrating vessel also influences the membranes in the abdomen and chest, and indeed its syndrome of chi rebellius involves the membranes. That is, chi stagnates in the membranes and rebels upward, causing the various abdominal and chest symptoms. Next, the penetrating vessel and the female breast. The penetrating vessel disperses in the chest and the breast, and therefore its chi has a deep influence on the breast. Moreover, being the sea of 12 channels, the penetrating vessel influences all channels, including the connecting channels, being the sea of blood. The penetrating vessel influences all blood connecting channels. So we have here the illustration of penetrating vessels and the female breast. There is the membrane, the connecting compartment that house the glandular lobules, stomach channel where there is the milk ducts and glandular lobules, Chong, the milk ducts, blood vessels, and blood groove, the liver channel, the nipple, Renmai, the milk ducts, the fat. As the female breast is richly irrigated by the connecting channel, a pathology of chi stagnation in the penetrating vessel affects the breast, causing breast distension and or pain, and in the long run, breast lumps. Another way in which the penetrating vessel affects the female breast is through the membranes. The penetrating vessel, together with the directing vessel, controls the membranes in the abdomen and chest. The connecting tissues within the female breast is part of the membranes, and chi stagnation in the penetrating vessel always affect the membranes and therefore the breast. As the penetrating vessel arises from the uterus, which stores menstrual blood, and by virtue of its being the sea of blood and controlling the blood connecting channels, the penetrating vessel is responsible for the production of breast milk after childbirth. Breast milk is a direct transformation of the menstrual blood into milk. The Chinese says blood turns white. As the period ceases after childbirth, the menstrual blood turns into milk and flows up to the breast via the penetrating vessel. If the chi of the penetrating vessel stagnates after childbirth, the breast milk may also come out. This is a full condition of agalaxia. That is, the milk is there, but it is difficult to express because of the chi stagnation. On the other hand, if the blood of the penetrating vessel is deficient, the breast milk may be lacking because there is not enough blood to be transformed into milk. This is an empty case of agalaxia.